Okay, hello friends. Welcome to the second part of my pediatric digestive webinar, health webinar. Sorry for the slight delay. I was on a conference call, but here we go. So let's start right away with objectives. So today we're talking about, let me see, I want to make sure I share this. There we go. Okay. What is gastroesophageal reflux? Why does my child have it? What can I do to help my child with gastroesophageal reflux? And should my child be on medication for this? If my child is on medication, can I get them off? So let's begin on this, freeing your child from reflux and the side effects of proton pump inhibitors. So this is just a little review from last week. We'll do this every week just because I want to make sure we all know about the extreme health or importance, of gut health. And so again, talking about the reason why I got into naturopathic medicine and also the reason why I have a special affinity for the digestive system is because of my personal troubles with my digestive system. And when things are imbalanced, there are many, many different symptoms from immune system health to weight gain, fatigue, mood disorder, pain, skin disorders, food intolerances, etc. So remember, 70% of the immune system is located in the gut. So when that is off, everything tends to kind of be off. So what is gastroesophageal reflux? So it's often misdiagnosed in children, or it's sometimes just diagnosed too often, and we'll go into why. It's common in many pediatric practices to diagnose gastroesophageal reflux and to prescribe acid blockers to babies with colic or a lot of spitting up. And again, we'll go into the difference between excessive spitting up and reflux. Okay, so right now the current diagnosis is postprandial regurgitation, also known as spit up, which is common in most babies, right? And it's common because babies' sphincter, we all have an esophageal sphincter, it's still developing, right? And so it can spontaneously relax. And so usually it's closed, right? Unless we're swallowing, and then it closes again. And so as it's developing, babies' sphincters can sometimes relax open, and things can come right back up through the esophagus into, the throat mouth. So that's kind of, the development aspect of that. And also, if you think about we're carrying babies right on our hips, on their belly, we're often pressing on their abdomens, and so that putting that extra pressure on the baby can also increase that regurgitation. So it doesn't necessarily mean that children are creating too much acid in the gut. So regardless, there is some imbalance, like I said, because we're developing. So the other thing here is that reflux can actually be quite frequent. It usually begins around 2 months of age and can last until 8 to 9 months. So conventional diagnosis of gastroesophageal reflux in infants is said to be rather harmless and usually resolves on its own by the time that children are walking. So, remember allowing the body, their little bodies to develop enough that their digestive systems can start to kind of work on their own. Children should not be diagnosed with gastroesophageal reflux if they are spitting up frequently, like 6 to 9 times a day, but still thriving. Okay, so I might get a lot of questions there, but know that. So if they're still thriving yet they're spitting up a lot, that's not necessarily gastroesophageal reflux. Okay, all right, so that's what it is there. And this is just a picture to show kind of what is going on in gastroesophageal reflux. So in the top picture, that's normal, right? So that esophageal sphincter that we were talking about, that's what can become relaxed in babies because it's not completely developed. So the food goes through our mouth, into our throat, esophagus, down all the way into our stomach. So this is a picture of the stomach. And we have hydrochloric acid or stomach acid, as we've heard many times. The stomach is an acidic environment, right? And that is to break down the food that we're eating. Okay, so the stomach begins the digestive process, and then it moves on down the digestive system into the intestines, etc. So as you can see on the bottom pictures, the right-hand side, the lower esophageal sphincter can become open, allowing the reflux. So that is just a diagram to show you that. Some signs and symptoms of reflux if your child is actually experiencing reflux, and it's not only in infants, remember, this can also be in school grade children. But we have apnea and desaturation, failure to thrive, that's a big one, feeding intolerance, nipple aversion, so having a hard time feeding, general irritability, fussiness, especially after eating, lung disease, excessive choking, and a lot of spit up, okay? And we'll get into also, when things become dangerous, we'll get into that. So those are signs and symptoms there. And the other question is, well, if my child is not even having reflux, or maybe he or she is, why does my doctor immediately go to medications? Well, that is just, their model. And the traditional treatment by pediatricians is prokinetics, so helping to actually move the food down. Gastric acid suppression, so that would be decreasing or suppressing the stomach acid in the body. So proton pump inhibitors, histamine antagonists, those decrease the stomach acid. If truly the body is having too much acid, that can be helpful to decrease that acid. But oftentimes, remember, it's not necessarily that there is too much acid, right? So now we're just decreasing normal amounts of acid. So going forward, the body is kind of confused, and it's like, well, I was making enough acid, and now the medication is telling me not to make more acid, or any acid really for that matter. So going forward, the development of the stomach can become inhibited, especially if there isn't truly a problem with acid secretion in the stomach. So just heads up there. And sometimes, like I said, that can be dangerous going forward. The development in the child can then become inhibited or halted. And additionally, these treatments don't necessarily heal the underlying cause of disease or address the underlying cause. So it's important to, investigate, figure out what is exactly going on. Is it truly high stomach acid, or is it just that, as they feed, I'm pressing against their stomach and now they're spitting up more, right? So thinking of that there. These medications, like I said, they can be a Band-Aid, and sometimes children just need the time to develop. Not every child develops the same exact rate, right? Additional reasons for, being aware of too many medications at such a young age is it can cause leaky gut, it can cause food intolerances, among other things. So basically, I just want you to ask your doctor why. What, is it truly because there's too much stomach acid? Is it truly because the esophagus and the stomach and intestines aren't, properly moving the food along? So making sure to ask those questions. Remember, I said this last week too, but the body doesn't do anything randomly. Okay, so the body is very, very adaptive. So it's going to kind of change, mold, adjust, adapt as things are different, right? So if the body, we're eating something that the body doesn't really like, well, we're going to maybe spit up or choke a little. Not to say that's normal, but the body does respond in beneficial ways usually. Okay. So traditional naturopathic treatment, something that I might suggest to my mamas with babies having a hard time feeding or with reflux or a lot of burping, spit up, would be, let's first try to adjust body positioning. Okay. So making sure not to have the baby completely horizontal. Also not on its stomach right after eating. Okay, making sure that we're sitting up, just like with adults. After we eat, we want to sit up so that the food truly can go through gravity and down the digestive system. Okay, so eating slower, and the sitting up would be like for 30 to 60 minutes post-eating, straddle holding for nursing. So there are ways to adjust body positioning to see if that helps. Another idea is milk thickeners for newborns. So if we're on formula and there's a lot of spitting up or reflux, adding a little bit of thickening agent, a natural thickening agent like a rice cereal, to help kind of bind it up and move it down, can sometimes be helpful. Avoiding foods, this would be really for mom, to avoid foods that can increase GERD like in adults. So spicy foods, chocolate, too much garlic, soda with the bubbles, foods like dairy that someone might be intolerant to. All of those things go through the milk into the baby. So thinking about avoiding those foods. And if it's a school-age child and they're eating solid foods, avoiding some of these offending foods can be helpful. And then when needed, herbs that soothe the digestive tract. So again, something I said last week is naturopathic doctors have a lot of tools in our toolbox. And so we try to always start with, diet, lifestyle, so that, like I just mentioned, body positioning, milk thickeners, food changes, and then going to supplements as needed. So that would be something I could help out with. But there are many herbs that can help kind of soothe, coat the digestive tract. Okay. So then when can gastroesophageal reflux become dangerous? Urgent investigation would be when you notice green vomit, meaning bile usually, blood in the stool, failure to thrive, extreme lethargy or fatigue, seizures, extreme abdominal tenderness or distension. Those are times that we would need to bring baby to doctor. When it becomes more chronic in school-age children and teens, there's also a need for more investigation for the root cause of disease. So if baby infant has had esophageal reflux in the past and it becoming more chronic as they get older, we want to start to look at underlying causes of that. Occasionally, reflux is associated with failure to gain weight or to meet normal growth standards. So that's another time when we want to make sure we're checking in with doctor. There can be possible structural damage to mucosa, aspiration into lungs. It can interfere with nutrient intake or absorption that can cause deficiencies such as with iron, meaning anemia. So those are some of the things that can result in if it goes too long without being treated. And when children are exhibiting symptoms of failure to thrive or increased irritability, extreme fatigue, etc., the underlying cause to examine first is the food reactions via the mama's breast milk, or a reaction to formula. So, there are kind of stepwise things that we can look to first before we all of a sudden give medication, for example, and that it would still be important to work with a doctor, but knowing that it's not always the worst thing It's not always, GERD, but looking at what we're putting into baby to see how they're reacting to that. Okay, so then on to medications, proton pump inhibitors, again, a common conventional treatment. If baby, child, adult even, honestly, you're on PPIs and want help getting off of them, I do have experience doing this. Proton pump inhibitors nowadays are used long-term when originally they were not supposed to be used long-term. They're supposed to be used short-term for acute cases, and that has changed. So with long-term usage, there are risk factors involved. That includes diarrhea, nutrient deficiencies, increased risk of infection, and lowered immune system, weakened bone structure, leaky gut, and then poor digestive system development, which I kind of mentioned before because it's been depressed, right? Suppressed. If, like I said, if stomach acid is being secreted normally, and then we decrease it even more, the body has to adjust to that. So then it doesn't make as much anymore. Okay. So there's some development factors there. Okay. So I did kind of go through that. It feels kind of quickly. But just remembering that, naturopathic doctors have a lot of tools in the toolbox. And we kind of act like investigators sometimes, really trying to find the root cause of the disease. I don't want to just throw everything at you at once. We want to truly do some investigation, some digging, and see if we can alter lifestyles, diet, add some things into the routine or take certain things out before we go to higher intervention. Okay, because our philosophy is to bring the least harm necessary to patient and families, et cetera. So I really care about, growth development going forward, supporting mom, parents, family as, we're trying to figure out what's going on, but also making sure to not suppress any system in the body. So encouraging development throughout the whole process. So what can I do now? What can you do now? So we want to make sure that from the start, we're supporting health and digestion. We want to maintain both mom and baby. We want to maintain a basic diet, nothing really spicy, rich, anything like that could maybe harm digestion in baby. Making sure to get a well-rounded, balanced diet, and then supporting your child's body's ability to feed. Not all moms can feed the way that they want to. There are definitely issues with that, whether that be mom making milk, baby feeding and latching on. There's a lot that goes into lactation and feeding. So if you need resources, we have those as well if you're having trouble feeding, but making sure to position the child properly when feeding, assess for food intolerances if there is excessive spitting up, and then of course using herbs and other nutrients to support as needed. And some take-home points here is that you don't need to suffer. Families, babies, children don't need to suffer. There are imbalances. We all deal with them. But there are also ways to bring us back into balance. You can achieve a healthy gut. There are definitely ways, and don't let spit up scare you. Okay, not again reiterating this again, but not all spit up is reflux. So just remember that. And like I said last week, your child is a powerful little human. There's a lot going on in there. There's a lot of growth, development, new things that they're encountering. And so knowing that and giving them some love and patience and kindness. So what do you want to create for you and your child? If you liked this presentation or you felt like it resonated with you, you have some more questions, feel free absolutely to take the next step in coming to see me, and we can set up a free 15-minute discovery call, answer any questions that you have, concerns, see if there's something that I can help you with. But I would love to support you guys. And I want to make sure that you are healthy, your child is healthy, your family's healthy, because it really matters. You matter. So with that, that is all that I have today. I will see if there are any questions here. But otherwise, this is posted on Facebook. So if you have questions that you think of later, go ahead and comment or ask questions on Facebook, and I can answer them that way too. All right. No questions. Okay. Well, we'll see you guys next week. That one is going to be on digestive abdominal pain in kiddos. So we hope to see you next month or next week. I'm sorry. And I hope you guys have a great rest of your Wednesday.